Hello, and welcome to this session on using data for quality performance and assurance. My name is Jeff, and I lead the data and analytics team here at Change Go Live. Now, I know it's not the most catchy of titles, but we will come to that in a moment. But firstly, allow me to introduce a little bit about Change Go Live. So we are a health and social care charity, and we deliver services across England, Wales, and Scotland. Services include street outreach, domestic violence, mental health, stop smoking. We deliver a range of other services and interventions too. We are best known for delivering drug and alcohol services to adults and young people in the community and in prisons as well. We've grown from quite a small organisation. We were a tiny volunteer-led charity not so long ago, and now we're working around the country. As you can see on the slide there, we've got about 4,000 staff. Very privileged to have a further 1,500 volunteers supporting us. And in any given year, we've been supporting around 200,000 people as well. So quality performance and assurance. I mean, really, that's a means really for our core focus, and what I'd like to talk to you today, and that's about using data to save lives. Genuinely doing so, and we'll share some examples and evidence of how we've managed to do that. There's two core reasons for us to be focusing on this. The first is that drug-related deaths are at an all-time high. It's a focus for our sector, and therefore how we can use data to support this is absolutely vital. And the second part is perhaps inevitably is COVID-19. I'm not sure we can have a presentation at the moment without this topic, but yes, we will touch on that a little bit later. So here's the start of our story for today. How we've been using our data, it was felt was very limited. Interestingly, we've got quite a lot of data. We generate a lot of data ourselves. Our main source of data is our electronic health record system. So working with more service users as time has gone over the years, delivering more services, everything was starting to get bigger. The requirements on us to demonstrate our outcomes were getting bigger. The requirements of those of our commissioners and their needs in terms of their reporting was getting bigger too. And we were just stifled by the technology that we were using, and we needed to improve engagement as well. Whilst we were producing all these reports, producing them every month or every week, often on an ad hoc basis when people come with curious questions, we just weren't able to support with those requirements. Took too long, too slow, and yeah, people just weren't really connected with them. We were using Excel for pretty much everything. We would use Excel to extract data out of our systems. We'd use Excel to blend the data together, to transform that data ready for presentation, and we would present it as well in Excel as well. And you know what? For a while, that worked for us just fine. Obviously, having to keep in mind that to make best use of our charity resources, the size that we were as an organisation and what we were able to spend on the technologies, all had to be considered. But in that time, and as we've grown, as I say, that only worked for a certain period. There's a real desire really to move from compliance to insights. We wanted to automate what we were doing. We could free up that capacity, along the way improve our data governance as well. And in all honesty, it was everybody from the board to those working on the first line, all asking for the same thing. We've got plenty of data, but what does it mean? What does it tell us? What can we do? What's the actionable insights we want to take from this data? Where should we put in our energies? Where should we put our resources? Tell us what works. Tell us where the attention needs to be. But simply put, we just weren't doing justice to the data that we had. As I say, we're working with so many individuals with so much information, and we have so much learning in that data that we weren't able to capitalize on. And here's just a quote to share with you from Prun, who's our medical director. We are sat on a gold mine of data. He would often talk about this and how we really need to move on and capitalize on that. And that's Prun, someone we work with very closely over the years. So what we did, the first thing we did was put relationships first. We're very fortunate to have a very data savvy executive. They are very strong in being able to understand data, to know exactly what the focus needs to be with the data. They can understand it, and they can relate what happens in our operational services to what they're seeing in the data too. So jumping on board the executive, building on the fact that they are, as a wider team, they don't need any arm twisting in terms of how data can make their lives easier, how data can provide the insights that they are looking for. We had lots of conversations with a range of people. Some of it was quite difficult to hear, actually. As I mentioned earlier, around that kind of engagement with the reports, we were producing all this information, which wasn't quite connecting with certain user groups. And as I say, what they were saying, telling us, tell us what's important. The other thing that's a benefit across Change Grow Live is we've got quite a curious workforce. We're quite curious as an organisation. People are always interested in asking those questions, always looking to improve things. Things never sit still at Change Grow Live. We're quite fast paced, and therefore we really needed to make sure that the data could be able to feed those curious needs. And yes, that main question was, what do we need to do to move towards actionable insights? The other thing we did was be humble in the process. We didn't have all the answers. We had to reach out to other people for their support. We actually reached out to others who had been through a similar process to understand from them what works, to understand from them what mistakes they made. We knew that we'd be making mistakes ourselves along the way. Again, I'll talk about that in a moment too. And I think the other thing in terms of relationships is engagement with our trustees as well. We went through a series of papers that were put forward in terms of how we wanted to move forward with this, and very grateful for the support that the trustees gave us in that too. One of our three values is being bold, and that's something certainly that we've had to do along the way as well. As I say, reaching out to others who could help us, looking out to different sectors, those working across the NHS, and understanding what they have done, the journeys that they've had. So having some quite honest and bold conversations with those organisations was really helpful. We tried some new tools, and we had to throw away some of the work that we produced on those tools when we realised that we probably weren't quite hitting the mark. Everything we did, we were testing with different various groups, and if it wasn't quite what we wanted, it was quite hard to swallow that we'd done lots of work and we'd had to throw it in the bin, but that's what we had to do. But that was, I guess, a key driver actually for us was that testing along the way, trying different things, trying different tools, coming up with some dashboards we thought would make an impact, choosing some topics that had real meaning and profile the organisation. So bringing everything together was something that was really impactful for us. However, it has to be said that COVID really did change everything for us. We were going on a certain journey path, rolling things out, trying different things, and then COVID came along, and yes, the world changed. So here is the inevitable COVID-19 slide. Obviously, it's been very tough period. But if you're working in healthcare, it has not been a lot of fun. I can tell you. At Change Grow Live, in our situation, we've got upwards of 34,000 individuals who are picking up vital medication. A fair proportion of those are picking them up every day or several times a week. We think back to March 2020 and the announcements that were made. People asked to stay at home. Particular groups of people asked to shield. And so how, as an organisation, we had to respond to that for groups of people who would typically be in the community, go into pharmacies, picking up medication. Some very difficult decisions had to be made. The organisation wanted some assurance around those decisions, particularly the mitigating measures that were put in place to support our service users. So the phone rang pretty quickly during that period. The data was required to do this. The data was, to quote a colleague of mine, front and central to how the organisation responded. to that situation. A range of service users with complex needs require priority reviews. The data we had to provide to support our services in how to prioritize, who to prioritize, and what information mattered in terms of those cases. As mentioned before about kind of producing monthly or quarterly reporting, that changed to daily. Required at 8 o'clock every morning. Whether it was those priority review service users case lists that were going out to our services. I was attending our executive meeting a few times a week to give them an update on some of the measures and some of the metrics that we'd selected that would help us and guide us through the process. I was talking to our senior leadership team meetings. That's a group of upwards of kind of 75, 80 people. And what happened at this point was our turning point really for starting to produce lots of analysis. So moving away from here's a spreadsheet of data to here's what it means, which we hadn't done to such a degree before, and we're able to direct the organisation to the things that require attention to help us learn what works. At the same time, in fact, before COVID, we'd started our rollout of Tableau. That was the tool that we chose, and again, that increased. We had to scale that up pretty quickly. Training our staff members. We started to run drop-in sessions for people to ask kind of those more curious questions around how they're using Tableau, and we brought along guests to share the impact for them. So it wasn't just us talking at other people. We had Tableau users coming and sharing how they'd used it, whether it was for visits with their commissioners, how they'd save time for their workforce, how they've been able to focus on the things that matter. All these great stories we've been able to share across our organisation. And again, I think that really felt a key moment for us as a wider organisation, and particularly for our workforce, to see the real value in data. The ability for data to save lives was a crucial moment for us. Another quote here. This one's from Mark, our chief exec. Using the data and as quickly as we did was a huge factor in keeping our service users safe in response to the COVID situation, which was given the tough times and the long hours, and with everything else going on in the world, really proud of our team for pulling together in that moment. Going the extra mile doesn't do it justice really, but to get a quote like that back from Mark, I know meant a lot to myself and to our wonderful team. So I wanted to share with you some examples of some of the things that we've been doing, that we've been developing. I mean, some of these have been in operation for a little while now, a few years, but we've already, as I said, to accelerate some of these during or since the COVID period. First, I want to talk about naloxone. So naloxone is a life-saving medication. It's used to counter the effects of an opioid overdose. Those that work close in our sector will understand that drug-related deaths are record high, as I mentioned earlier. So we want to understand the penetration of service users that are within the naloxone kit. Understanding that was our first requirement. We wanted to understand which services require support and those that are doing well we can learn from. And we wanted to see how the things were changing over time. So we started to track this using box and whisker charts. We use box and whiskers a lot at Change Grow Live. Now it's hard to do justice to a dynamic dashboard on a slide deck, but I will try my best to talk you through this one. In this case, this dashboard it's updated every day, and I've just chosen 3 dates. I've chosen 19th of March, which was the Thursday before the first lockdown last year. I chose the 1st of May, which was a few weeks into the first lockdown period, and I've chosen a date in April this year, just shortly before I'm recording this session. And in each box and whisker chart, each dot represents one of our services. So essentially, if a dot is near the top, they're doing pretty well. That means that more proportion of their service users are issued with an naloxone kit, and if they're lower the bottom, it means there's room for improvement. And what I've done is I've highlighted a service. I've highlighted one of our services in Lancashire. So you should be able to see a green dot there. You can see how things have changed over time. They were in the just below the median in the interquartile range in March last year. Fast forward to, excuse me, to May, and they're almost bang on a median service. They've improved. The dot is higher, so there's more service users with the naloxone, and proportionate to other services, they've improved. And then fast forward to this year, they've improved slightly, so more service users got naloxone, but you can see they've dropped into the bottom quartile, which means that other services across change have actually improved relative to their position. Other things that's heartening, I guess, from a governance perspective, and is if you look at the size of the whiskers, so for the difference between the top and bottom service reduces over time. So almost you haven't got that kind of postcode lottery, I guess, that no matter what change or lift service you walk into, you've got a better chance of getting a similar quality of service. So again, these are the sort of things which we were looking at in great detail during the COVID period. The second thing to talk to you about is medication-assisted treatment. It's a huge program for us over the last few years. So or MAT as we call it, that's prescriptions for typically methadone and buprenorphine, evidence-based, powerful interventions that can support our service users. Yeah, improving the quality of MAT is a huge focus. We'd like to know a little bit more about our service user journey and how they differ from service to service. And as ever, we wanted appealing and easy to understand visuals for a program that can get quite complex and in its detail. Here's an example of one of the charts that we've got here. Again, I've chosen a couple of dates. I chose October last year, and I've chosen March this year. So on the left-hand side, you've got kind of numbers, and the size of those charts show the proportions of service users are in a certain, what we call a MAT stage. It's not always as linear, but typically a service user may work up through the MAT stages from MAT 1 at the bottom up to MAT 4 at the top. And what this chart allows services to do, and this is for our organisation as this is for our Hertfordshire service as a whole. There, we can run it across the whole organisation. We can run it in different regions by certain directors. And what this is showing for Hertfordshire is of those service users who are in that what we call the red category last October, where are they sat now? So it's useful to see those that perhaps are still in the red groups. You can see that that's a slightly thicker line there is in the red. We've got some that's moving into the green, very few into the green, but mainly into the red, grey sections there. Which very insightful for our services, and they can think about how they can tailor their service offer, perhaps if service users stuck in a certain stage. The third thing to share is about hepatitis C. Most cases of Hep C actually for those individuals with injected drugs and can be dangerous if left untreated. But thankfully, with modern treatments, it's usually possible to cure the infection, and people can lead a normal life expectancy. So again, we wanted to use the data to focus on what matters. How can data save time for our workforce and save lives at the same time? And how can the data embed this into everyday practice? Now, data's been at the forefront. It's been a real data-driven project, hepatitis C. And I wanted to share one visual with you here. And what this is doing here is it's plotting every one of our services as a dot. The bigger the dot means it's the bigger the service. They've got more service users in that service. And across the bottom axis, you've got percentage to test. So that's the number of individuals who are being tested for Hep C. We want as many people as possible to be tested. So on the right-hand side is the place to be. And on the left axis, going upwards, of those that do test and test positive, how many of it is treatment start dates? The higher, the better. So we use some colours here. So top right is the quadrant. That's the desired position. So doing lots of tests, and again, those that test positive have a treatment start date. And we've been using these visuals a lot, filtering it for perhaps those of our entire client group, filtering it for those who are just injectors only. And again, it's allowed us at service to focus on things that matter, direct interventions to individuals that require specific interventions targeted to them. And yeah, it's been at the forefront of the hepatitis C response for a little while now. So has this led to more data-driven decision making? Do you know what, we're not too bad as an organization, it has to be said. We've always taken data seriously. As I mentioned at the start, we could have been using it better. We probably were using it more for kind of compliance-led things, and I think we've really shifted that in the last couple of years, to be more focused on the service user, focused on what matters, trying to save time for our workforce so they can target things as best as we can. I think it'll always be a work in progress, but we have made great strides. A quote from one of our directors, or our executive director, not so long ago, in a regional meeting, was that if you're not using the data to help your decision making, then what are you using? I thought it was quite interesting. The exec and our trustees do lead from the front, as I mentioned earlier. I now attend the exec meeting once a month where we talk about data, and actions are taken from the discussions. I meet and join our quality and performance committee, one of the subcommittees of the board. I provide a paper in advance and have a verbal slot to discuss how our performers are looking from the perspective of the quality of our work, to provide assurance for those present. And we've also embedding the use of data into our wider thinking around decision making. So, for example, those familiar with the Cynefin framework, the difference between kind of complicated and complex, and supporting our services with their decision making, and how we can embed data around that as well, has been a really fascinating piece of work. So yeah, stuff we learned, and in all honesty, still learning. And I mentioned that point at the start about humility. We really have learned so much along this journey. I think our ability to adapt at times when things weren't going so well. I remember going to meet our chief executive at very early days of sharing some dashboards, and then he just wasn't having it, actually. We went bouncing in with joy, and thought this would be a game changing. Again, we went to go away, scratch our heads, understand why we felt that we had that impact the way it had. As I say, having an invite to the monthly exec meetings hopefully showed that we were able to go and make some changes, and make it click a little bit better for other people. As I mentioned earlier, the fact that we had to go and throw some stuff away, something one of my colleagues talks about a lot, is having that that challenge whereby you've invested so much time into something. Might be quite hard to peel yourself away from something, but sometimes you just need to face up to things, and be open and be bold, to make those decisions. I think we wish we'd been further along on our journey than we were when COVID hit, but to be honest, it could have been a lot worse too. Some of the other tools that we use, we use a tool called Ultrix, as the engine room for a lot of our blending and bringing the data together. Very agile tool. So we're very thankful that we had that tool in place that enabled us to scale all this up very quickly last April. And yeah, embedding this will take time. I've talked about the different pockets of the organization. There are some services that are absolutely running with this. They are loving it. They're taking it to their team meetings. They're having real kind of deep conversations around how data can improve what they're doing. First line workforce very excited. We've got some services that are some way behind the curve and have got some way to go. And that's our key challenge actually moving forward, is how we can engage better with those services, who again haven't quite clicked for them yet. Thank you very much for listening. I really hope that you found that interesting. Hopefully it was insightful. But yeah, that's the story. That's our journey for over the last few years of how we've tried to change how we use data, particularly with an eye on performance, quality, governance, but with a real focus on how we can use it to save some lives. My details are on the slide there. Welcome to give me a call. Drop me an email. This feels very old school. There's no social media links on there, but I'm sure you can find me on LinkedIn, and on a good day I might log in there myself. Yeah, do pop any questions in the chat too. I'm happy to pick those up, and thank you very much for listening. Goodbye.